Regular council meeting to order. Recommendation that the agenda for the regular council meeting of November 8th, 2021 be adopted as presented. Moved by Councillor Adey, seconded by Councillor Murrow. Anybody opposed? Motion's carried. Before we get started, just like to introduce our new city manager on the job here, Mr. Rob Buchan, tonight. This is his official first meeting, 5 days now on the job. And I also understand we have a bit of an announcement to make on a new staff hire as well.
Thank you, Mr. Mayor. It's a pleasure to be here in this new capacity for the first time. And yes, we do have an announcement. We closed our competition last week, last Monday, for the city planner position. And I'm pleased to announce that as of today, this afternoon, we hired our new city planner, Dr. Coralie Breen. And she's here with us today. Coralie is a community planner and with experience at regional and municipal governance. In current and long-range planning, most recently with the Cowichan Valley Regional District. She is known for her expertise in complex community development planning and community engagement and consultation. She holds a PhD in public administration as well as a master's in planning. I have had the pleasure to work with Coralie in the past, and I know her to be an exceptional project manager, community builder. She's innovative and comes to the table with solutions. In other words, she will fit in very nicely with the staff that we have here now.
Excellent, and welcome to the team. We're looking forward to working with you. Okay, moving on. Item 3A, recommendation that the minutes of the special council meeting of October 25th, 2021 be adopted. Moved by Councillor Randhawa, second by Councillor Murrow. Anybody opposed? Motion's carried. Item 3B, recommendation that the minutes of the Committee of the Whole meeting of October 25th, 2021 be adopted. Moved by Councillor Cunningham, seconded by Councillor Niche. Anybody opposed? Motion's carried. And item 3C, recommendation that the minutes of the regular council meeting of October 25th, 2021 be adopted. Moved by Councillor Adey, seconded by Councillor Randhawa. Anyone opposed? Motion's carried. Okay, tonight we have a delegation from Northern Health. I believe they'll be doing a bit of a presentation. City Council requested that they come forward to chat about the hospital in Prince Rupert and some of the strategic plans they have for this coming decade. So I thought maybe we'll hand it over to you guys, and you guys can maybe introduce yourselves. And I think you're going to start with a presentation, and then we can just we'll go from there. Does that sound all right with you guys?
Yes, thanks, Mr. Mayor. I really appreciate that, and appreciate City Council making the time for us tonight. I will start by letting my colleagues introduce themselves. We'll start with the Chief Operating Officer of the Northwest.
Thanks, Julia. And yes, thanks to yourself, Mayor Breen, and to Council for the opportunity. My name's Chiro Panessa, joining you today on the unceded traditional territory of the Tsimshian here in Terrace, where I live, work, and play with my family. And I'll turn it over to my medical co-lead.
Thank you, Chiro. Good evening, everybody. And Julia, I haven't acknowledged you tonight. And as Chiro has mentioned, I'm his co-lead. I'm the medical director for the Northwest. And thank you for the opportunity to be with you tonight.
Thanks, Jaco and Chiro. And for those of you locally who don't know who I am, I'm Julia Pemberton, the Health Services Administrator for Prince Rupert and Haida Gwaii. Mayor Breen, do you have our slides, or would you like to put those up for us? Or does everyone have a copy of the presentation?
We don't have a copy. We weren't provided a copy. Do you want to do it, share a screen on your end?
Sure, I can do that.
Permissions for that?
Okay, can you see that?
We can, yes.
Perfect, excellent. Okay, guys, so as Mayor Breen said, we're here today to talk about the future of healthcare in Prince Rupert and to provide an update on our current status. especially given what we've been through in the last almost 2 years. We thought it was a really good time to connect with council. So our agenda today, we want to talk to you about our commitment to growth, our innovation for the future, and something that I'm really interested in presenting to you, which is the revitalization of the Healthy Communities Integration Committee. So what we'll do is we're going to start with recruitment and retention, as I know that this is a concern that is shared by all of us. And we know that recruitment and retention has definitely slowed down with the pandemic. So part of our focus is, as our services continue to grow, is to continue our focus both locally and regionally on recruitment. And I do want to take this opportunity to thank Council for their investment in the Make Prince Rupert Home campaign. We definitely have seen a benefit from that kind of online presence and have used that link in our recruitment materials. So thank you very much for your work there. As you know, COVID-19 has really provided an additional challenge to our existing staff, so to retain them, as well as finding new staff who want to come join us in the north. We are seeing a loss of staff due to burnout and pandemic fatigue, as well as a few staff due to the most recent PHO order. However, this, as we know, is not unique. This is a shared experience across all sites in the north, but we do expect it to take some time to return to our baseline staffing levels. And so what we wanted to do is share with you some strategies that we're implementing now to try to do that. So locally, what we're doing is we've just invested in some new housing units with some further investment to come. And that housing is to help with our temporary staff, but also as a landing space for new staff. As we know, housing has been an ongoing challenge. But I've seen some real improvements actually since I first spoke with council when I joined as HSA. So I'm excited to see where housing goes. Internally, I've really championed a focus on culture and improving teamwork and psychological health and safety in the workplace here at Prince Rupert Regional Hospital, in our long-term care, and also in our community services. What I heard from my staff when I joined was that they'd really like some stability in leadership. So I am happy to say that I've been able to build a complete leadership team for the West Cluster since starting as the HSA. And so my focus is really on keeping that team that I've been able to build over the past 18 months through supporting them and so that they can support their staff. The other thing I'm doing is in 2022, I have 2 community funding strategies to support our recruitment and retention. One of them is on staff wellness. So there's a few different community projects that we have, including updates to staff rooms, the potential of a gym, and some other projects that we're working on gaining funding for to help make this a nicer place, a better place for staff, and to create small spaces within our hospital where staff can take their breaks and recuperate from their job. The other strategic planning that I'm doing for community funding is on a surgical and specialized service equipment renewal. So that's to make sure that our staff have the right tools to do the job, and we're replacing any outdated and out of service equipment. And then Chiro can speak to some of the regional and provincial things going on in terms of recruitment across the north.
Thanks, Julia. And I just saw Dr. Guillaume Coetzee has been able to join us. So I'll just pause for a minute to let Guillaume say hi and introduce himself, and then I'll jump back into those other pieces.
Hi, sorry for being late. I was caught up with some work commitments, but Guillaume Coetzee, I'm a family physician in Prince Rupert. I've been chief of staff for the last 6 or 7 years, and happy to be here and try and address some of your concerns.
Thanks. And Dr. Forey and Coetzee will be able to go into some of the significant work that's been happening around medical affairs and physician recruitment shortly in the presentation. But I'll just, building on what Julia said, we are organizationally trying to do a few different things in addition to those local efforts that Julia described. And I'll also talk about a brand new provincial initiative that was recently announced in September. But some of the things that Jaco and myself have been looking for to support operational managers and clinical teams is to create some more educator positions in the Northwest. And some of those, we kind of are more focused on where we can get the best candidate. And some of those will end up being in Prince Rupert or other locations across the Northwest, but supporting clinical teams across the Northwest. And we've recently created positions, educators for long-term care, critical care, and maternity, which we hope will be supportive to teams going forward. We also, managers, members of Julia's team, including Julia, have to spend a lot of time on HR processes and transactional activities, creating positions, approving vacations, reviewing rotations and schedules. That takes a lot of time and effort in addition to problem solving and supporting clinical teams and creating good team environment. So we are more and more creating more HR support positions for managers that would be in Julia's team and local teams across the north and in the Northwest and Prince Rupert is benefiting from that as well. Also, we know, and despite all the really good effort and some different initiatives that are underway and spearheaded with yourselves at the City of Prince Rupert and others, we're in a critical shortage of healthcare providers, and we have Prince Rupert continues to have very significant vacancy rates. In acknowledgement of that and some other areas in the north where we are seeing some really significant vacancies. In September, they did, the ministry supporting Northern Health with an additional, some additional funding essentially for us to do some further rural retention incentives in Prince Rupert and some other communities in the Northeast. That's going to allow us to think through some incentives, which will hopefully be coming into place in the very near future here for certain high priority healthcare providers in Prince Rupert. Will also allow us, as Julia alluded to hopefully continue some of the early investments we've made to increase housing for to support staff and also and this will be quite innovative for us, a space we haven't done before, but we've heard a lot from our teams, would be very helpful, and that's daycare. So not that we'll necessarily at this point be running any daycares, but we'll have some, I think, funding to explore some partnerships to help spur further development of childcare seats or expanded hours of operation for childcare to support healthcare workers on shift work and that need childcare in order to support their kids while also providing a valuable service to the community. So I think that's quite exciting, and Julia and Guillaume will be able to share more details of that as that unfolds and we work out the details of that most recent support from the provincial government, which we're very, very grateful for. Also, I think we're going to see more and more, and this kind of lines up with some of the education pieces that Jaco and I have been doing, but we're going to see more and more in-house training. And that's been started with the support of the provincial government with the healthcare assistant training program, where we currently have a number of trainees in Prince Rupert and across the Northwest who are training to become care aides. And we'll start to see in the new year some of those first graduates. And we intend to continue that kind of programming, but then also, and to do this as much as we can locally in a community like Prince Rupert, but how can we more and more start to train other healthcare professionals? Just giving opportunities for people who are wanting a career in healthcare to start that healthcare career path in their local community and be trained locally at the hospital or within Northern Health Services. So I think we're on the very beginning here with the care aid training, and I think lots more to come there too, because that's going to be an important tactic for us to for supporting recruitment. Okay, I think that's it, Julia. So back to you.
Perfect, thank you. So another important part for expansion and growth, right, is dollars, is capital investment. So I've just outlined on the slide just some estimates, total estimates of investments in 2021. And what the minor and major capital from Northern Health really focused on, you know, besides our normal replacement projects, was we did spend a lot of time and a lot of money invested in pre-planning stages for quite a significant main floor redesign. So I know Guillaume is involved in this work as well as our other members of our staff, but we have started the planning with the engineers and we've done our mapping of our space. So we're really excited to see where that heads in 2022 in terms of the expansion and redesign of our ambulatory care space and our ER. So that's something that we're really celebrating this year. And the big investment from community, which I have to say I was so touched by, especially the DP World workers who were giving out of their own income for this project. And I know we had several other supporters across the city that I'm grateful for, but the $300,000 bed replacement project. So that project really gave a much needed boost to our long-term care facility, especially as it was announced right during our COVID outbreak, which was pretty devastating to our team. So with that money, we were able to actually purchase 57 new beds for Acropolis Manor, as well as a few new beds for acute care and 7 new stretchers for our ER. So that's a tremendous investment in 2021 in terms of addressing a long outstanding equipment issue. And we also saw good news, bad news in this situation, but we, as some of you may know, we experienced a pretty significant fire in May 2021. So the outcome of that fire, while the fire itself was small, the damage was significant. So the outcome of that is we actually are seeing a brand new lab with all equipment, floors, walls, you know, like basically a brand new lab put in, as well as we've done 1 out of 2 ultrasound suites that have been replaced in the hospital. So it's about a $7 million project right now with the second ultrasound suite under construction. So we will see the main floor basically from rehab up really redone in 2022, which is going to make a big difference in terms of how our patients experience care, flow through our hospital, wayfind, and how our staff and our physicians are able to provide care to them.
Yeah, I can speak just before, and then I think folks, Julia was flagging, folks wanted a sense of some of the virtual care options and other ways that we're supporting accessibility outside of the ER. And, you know, I'll preface first just by saying Julia, myself, along with Jaco and Guillaume, we all have a very shared vision that as a priority, what we need to have in all of our major communities in the Northwest is a vibrant a group of family physicians and primary care providers like nurse practitioners that can be well supported so that we can have longitudinal care as a foundation of care and available for residents and communities across the Northwest. We just know on a number of levels that's what ends up positioning people for the best possible outcomes. And I think you'll hear shortly from Jaco and Guillaume a lot of the work that's underway and the hard work that goes on to recruit and keep us with a vibrant group of providers to provide primary care. This is an initiative that has come out of the COVID pandemic, where we created initially a COVID line, and it has evolved now into we have a virtual primary care clinic, and that's open 7 days a week, and is an option or an alternative for those people who are wondering if they should need to go into the ER or not, and could instead have a virtual consult. And if for whatever reason they're not attached or not able to connect with their family physician. So that just is, I think, was something that council was interested in. So we thought we'd quickly just overview that for the group. But I think now we're going to turn it over to Jaco and Guillaume here to talk more about some of the different physician recruitment and physician efforts that have been underway over the last year.
Thank you, Chiro. Jerome, maybe I'm going to ask you to speak a little bit about your departures, as you are on the ground and very intimately familiar with the different physicians. So, if you don't mind leading up, please.
Yeah, absolutely. So, as you're all probably somewhat painfully aware, we've lost quite a few physicians lately and still losing a couple more at the moment. There's many reasons. Some docs are at a retirement age and they wish to retire, and some others are looking for other opportunities elsewhere and have decided to move on. So the one thing I do want to say is that all these physicians who have left us have actually served our community for a very long time. So all of these people have long service. So I'll try and kind of allude to that as well. So firstly, as you all know, Dr. Pinar, our OBGYN, retired. That was after 26 years, I believe, of serving Prince Rupert. It might have been 28. And did a phenomenal job here and is greatly missed by everyone. Obviously has an impact on services, and which is why there's a priority focus on recruiting into his position. We also have a GP who left, so Dr. Falwell. Dr. Falwell was here for about 10 years, and he did a lot of our emergency room work. His wife, Dr. Falwell, Chanel, left as well, and she was also a GP obstetrician provider as well as a GP C-section provider. So which means that we've lost 2 of our 3 C-section providers. The only one left here at the moment is me. We also had the unfortunate news of departure of Dr. Croft, and he'll be imminently leaving us, and he is the other GP obstetrician provider as well as the GP ER provider and very well loved family doctor in town, who's also spent more than 22 or 23 years in town. I can't keep track of it all, but so unfortunately he is leaving as well and winding down to his retirement, which I'm sure is well deserved. Lastly, Dr. Brown has served our community for the last 8 years. He is our sole internal medicine provider in Prince Rupert, and he is departing at the end of this year, but with the caveat that he will be providing service into the new year with some new information that Dr. Furby will provide you guys with in a minute. Kind of hard seeing a lot of long-timers leave our town and much beloved members of our community and medical community as well, and we wish them well. We hope that, they have a good retirement, and then we will make sure that our community gets provided with the same quality of care going forward. So over to Jaco about our new recruits.
Thank you, Guillaume. I'm going to give you a quick synopsis of our recruitments. With the departure of Dr. Pinar, we have recruited Dr. Sagarita Basu. She's from Glasgow in Scotland, working at a very high volume, high risk obstetrical unit, with bringing a lot of skills to the community, a lot of experience, and a lot of confidence. Her husband is Dr. Datta, again a general surgeon with all the core specialty skills, but he also brings additional skill set to the Northwest in lower esophageal surgery, and we do foresee exploring that skill set, which will actually help patients in the Northwest and the Prince Rupert region to hopefully get care closer to home and don't have to travel to the Lower Mainland. And that's for the future. And Chiro and I certainly have a vision in utilizing the surgical capacity and groups we have across the Northwest to mutually support each other and try to support also higher skill set programs that will help our Northwest patients to stay in the region. So their arrival is scheduled for, I think at the latest, we're looking at March of 2022. We also are recruiting a GP surgeon, and she also does obstetrics and ER and wants to do some primary care. Her name is Dr. Lauren Galbraith, and I'm going to use his name, so it's not confidential. And there's a very high likelihood that we are going to land her in Rupert. That's all indications. We're keeping our fingers crossed at this stage, but we're 90% sure we will be able to recruit her. We are particularly excited about the 2 internal medicine specialists that we've recruited. Both have signed letters of offers. The first one, Dr. Preventure, I really think, and I'm putting my neck out here, but I think she's going to leave deep tracks in Rupert and in the region in the years to come. It's very rare that you meet a physician that really checks all the boxes. Particularly relevant to Prince Rupert is this, that she's currently doing a 2-year fellowship in critical care. So she'll be coming to Prince Rupert with a critical care skill set that will be invaluable. You currently have 2 high acuity beds where we can ventilate and look after really sick people, and having her on site, being able to stabilize and ventilate, for instance, patients for a period of time will create a tremendous service to your community as well as to the region. She will be joined by Dr. Selby Killian. By the way, Dr. Preventure is doing a fellowship at the moment in New Mexico, United States, in a very good program. Her references were glowing about her and about her growth and about her humbleness and about her inclination also to work with Indigenous peoples, which I think is important. She'll be joined by Dr. Selby Killian about a month after her arrival. She's only arriving in July. Dr. Killian will be arriving in August. Dr. Killian is known to us in Terrace. She's done training here with the Internal Medicine Group as a resident from UBC. And we also think that she's going to be a welcome addition to supplement the internal medicine skill sets. I just want to mention that Rupert, in my memory, has never had 2 full-time internists, not in 30 years. So that'll bring tremendous capacity. It's also going to cut back on the traveling that patients have to make from the west to Terrace and else, well, to Terrace basically. Psychiatry, we currently do not have any permanent recruits. I just want to mention that psychiatry is one of the most difficult fields to recruit in. At last count, there was almost 80 vacant positions in British Columbia for psychiatry, many of them in very desirable locations in the Lower Mainland. As a very difficult recruitment portfolio. We are in combination, Chiro and I just, and Claire Hart, who is the Director of Community Services and responsible for psychiatry, have changed our strategy. And we are going to look at a visiting type, metronomic type service like we have internal medicine and Terrace, where people are high quality specialists are based in the Lower Mainland, but they come at very predictable and fairly frequent intervals to ensure continuity of care and longitudinal care for our patients. It's not the same as having a resident psychiatrist, but and we've lost Dr. Broster, but it's certainly creating that model properly does create a service that's robust and that's reliable. We've seen that before. We have one returning GP, Dr. Sophie Harrison. She's coming back from maternity leave, and she also does emergency room work, which is very, very useful in Prince Rupert, and she's returning in January. And then we have another GP, Dr. Hasari, who is joining us with interest in obstetrics, ER, and primary care. So if both Dr. Galbraith, as well as Dr. Hasari arrives, then we've got 2 GPs that will do obstetrics. and one additional C-section capability from a GP perspective, as well as Dr. Vasu with a C-section capability. As part of our maternity stabilization program for the Northwest, we also have Dr. Adulio, who is an OBGYN from Prince George, who is planning on visiting and keep on visiting Prince Rupert at metronomic set intervals for the foreseeable future, as long as we want her and as long as we need her. And that creates another layer of redundancy and depth to the obstetrical service delivery model. We also are looking increasingly, Gero and I, as well as our chiefs of staff and Julia and Jerome, at the whole a change in the way that we deliver services. And you probably noticed that with some of the surgeons from Terrace who's now starting to do locums in Rupert, like Dr. David Youssef is there for now for this week and has been there before. And that's going to be a regular occurrence as well, supporting the physicians in Prince Rupert. But we also would like to see, for instance, Dr. Datta doing some visits to Terrace to come teach some of our surgeons here what it is to do lower esophageal minimally invasive surgery, for instance. So we're looking at the richer environment of bidirectional travel, utilizing our operating room capacity throughout the region, but also starting to attract physicians and seek physicians with additional skill sets that we don't have. Because every skill set we bring to the Northwest is a family that don't have to travel somewhere else. It's care closer to home, and it's a richer environment. So that's the recruitment. I can tell you one thing though: it's a difficult recruitment season during COVID. It's really tough, and we have to work twice as hard to connect with people. It's all virtual, and it's people tend to hunker down and want to stay put. They don't want to venture around, roam around, come work in town to check us out. So it's been a bit tough go, but that's what we have so far. Thank you.
Thanks, Jaco. And again, just a special thank you to our council who have taken time out of their busy schedules to either meet with some of our recruits or take them on a tour of the town. I'm really grateful for you guys to make your time and partner with us in recruitment in that way. The next update is on surgical services. So there has been some conversation around what does surgical services look like, especially with the pandemic, where we had some changes in our elective service. And then where is it going in the future was also a question that we wanted to address. So I'll let Guillaume speak, especially to the first point about how we've been actually able to increase our surgical program, and then we'll dive into orthopedics.
So if I may, I'm just going to start just on the previous slide and just mention something that Dr. Forey touched on. So we did mention that Dr. Brett Broster had left, but he is still providing full-time service in Prince Rupert at this time. So just important to know that we're not left without a psychiatrist. We just don't have one in Prince Rupert with his feet on the ground here, but still providing full-time care. And we've recruited a nurse practitioner that has an interest in psychiatry who supports him from a distance, as well as the family doctors in town, quite willing to help, support the patients with feet on the ground while he is consulting from Victoria, where he now lives. And then, Dr. Hesari has already started this week, and she's essentially taking over Dr. Croft's practice. She's doing obstetrics, she's doing ER. She's liking it here. She's living just up the street from me. She loves the ocean view. She likes Prince Rupert so far, so we're very excited about that. So regarding surgical services going forward, I think there's a big focus, and as a physician providing care to patients in this town, I am very, very in touch with how patients are having to travel, having to try and find their services elsewhere when it's not available locally. And as a group, I think it's become a big priority for us to try and give as much as possible services here in Prince Rupert and in the region, and supported locally from the region itself, so that we can become almost a self-sufficient region with quality care. And that's really our focus. So as you can see here, we're looking at increasing our access to specialty surgeries closer to home. And this is where Prince Rupert OR becomes very, very important. And We have capacity in our OR, and we're hoping to increase ear, nose, and throat surgery, plastic surgery, as well as urology. And I know that there is a focus on recruiting additional ear, nose, and throat surgeon, an additional plastic surgeon, as well as an additional urologist to our region, and having them work in our hospital in Prince Rupert and utilize our ORs in order to provide this care to our patients in Prince Rupert. And this may evolve that we might be seeing patients from other places traveling here to have their surgeries in Prince Rupert as we utilize this operating room. Our orthopedic services are things that are very important to focus on as well. And as times are changing, it's becoming more and more evident that surgeons like working where they feel supported. Surgeons want to work where they have colleagues to talk to, where they have someone to discuss cases with, where they have someone to, lean on other people's strengths. And we're looking at the orthopedic service model in our region to try and improve not only access to care, but also time to care, and keeping a good quality care. So we're focusing on a way to make orthopedic surgery going forward more accessible, not having the wait times we currently have. For example, I can tell you without any doubt that with having Dr. Smith alone here in Prince Rupert as the only orthopedic surgeon, we're finding that he's on call every second week, in which times he's not able to see patients for regular orthopedic issues, apart from the on-call broken bones and things he has to fix. And it's become a focus that there is a need for more regular orthopedic surgeon services.
Thank you. Maybe if I can, sorry, Jerome, are you finished? If I can chip in here, but like Guillaume has referenced, we currently have an active posting up on Health Match BC for a second ENT surgeon. They're thin on the ground, but we're positive we are going to recruit one. We will imminently, Thierry and I are just wrapping our head around OR capacity across the Northwest and waiting for some additional metrics to come in. And in consultation with Dr. Gustafson, we will probably looking at posting a urology position soon. The problem with urology is that it's got very expensive equipment requirements, but there's a focus for a fundraiser. And of course, there's plastic surgery that now has come to Rupert on a much more reliable basis with Dr. Vandermeer, and that capacity will only increase. I think we have to recognize, and Thierry and I and the HSAs and chiefs of staff, we realize that the Northwest has shrunk in terms of the way that service is developed, because we're really looking at the Northwest as one big virtual operating room with capacities in different sites. And after Terrace, Prince Rupert, and you can actually go the other way around. If you look at OR capacity and bed capacity, Rupert might actually edge out Terrace, but it's a very important surgical center now and in the future. As you know, you at the moment have more surgeons you've ever had. You've had 2 general surgeons, orthopedic, as well as OBGYN. But going forward, we would like to enrich this environment. And when it comes to orthopedics specifically, we need additional skills. We currently have a significant number of people who have to leave the region for things like shoulder replacement surgery. To give you one example, we know that around 48 patients leave the Northwest to go for shoulder surgery elsewhere every year. That's about 1 a week. That's enough to sustain somebody with a skill set in shoulder surgery in the Northwest. So we really would like our patients to be able to get that service here. That's one example. So when we are recruiting to our new orthopedic model, we are going to look at additional skill sets beyond just core orthopedic specialty services. We need to do that in the interest of our patient needs, travel, and that will be a very important part of the recruitment landscape. And as Jerome has also mentioned, there's going to be increasingly going to see bidirectional travel. We're going to see people from Terrace getting surgery in Hazelton. We're going to see, and maybe some Prince Rupert patients can get quicker access in a place like Hazelton and might decide and have a choice to travel there rather than to wait an extra month to get it in Terrace, for instance. It's becoming a very complex environment, but that's where we are heading, and it's only going to be benefit to waiting times, patient outcomes, and patient satisfaction. There's no doubt.
Thanks,
Julia-
Jacqueline Galone. Oh, go
Julia,
ahead, Cheryl.
it might make sense actually to just, I'll go back to our next slide that I think skip down one here and I think I can just build off things here. So, you know what, Jaco and I often, him and I have been working together now for, I'm losing track. I don't know if that's a good or a bad sign, but 4 or 5 years. We very early on had sort of thought, we have a shared vision. And you know, what Jaco described there around the interconnectivity, the intersection, that bi-directional travel, we very much see it as we describe it as a network of services in the Northwest. And, you know, as Guillaume described it, almost a self-sufficient grouping of services in what is one of the most remote parts of Canada, really, providing high quality care. When we think about the new hospital build, it by design doesn't really have any significant increase in its OR capacity. That really has always been by design, knowing that in order to meet the surgical needs of the Northwest and to continue to hopefully continue to repatriate as much surgical and specialist care in the Northwest, you know, you don't need to build a significant number of new ORs in a facility like the new Mills Memorial Hospital. You can effectively, like we are trying to do, use all the ORs and have thriving surgical programs in every hospital across the Northwest. And really what the Mills Hospital is going to primarily enable us to do is have that, and we've all seen the need for this, higher critical care capacity, that intensive critical care capacity, and more capability to care for people with serious mental illness. And that's where we're seeing the greatest increase in sort of the bed count or the service increase with a hospital like Mills Memorial. I'll just pause in case, Jaco, there's anything you wanted to add before I just go back a bit on patient travel.
No, Chair, no, you've articulated well. I have nothing to add. Thank you.
I
Okay,
would
so
like to add something if I can.
yeah, go for it.
Looking at this as a provider in Prince Rupert, I'm actually very excited about those two things specifically. I think, you know, I can see the need for mental health care in our facility, and I can see the need for those extra beds. And I'm really happy that, you know, I think it's going to make care for our mental health patients who need admission a lot easier to access. We're doubling the capacity, literally. And I think it's going to make transferring those patients within our region a lot easier and smoother. And, you know, it's going to be much easier on the patients as well, because some of these patients obviously have to be sedated for transfers, and it's just way better transferring them close by. And the second thing is, I'm excited about the extra intensive care beds. I mean, we went through a pandemic where we require lots of ICU beds, and this is a huge increase. And as Prince Rupert physicians, we're super excited about this, because when the weather gets pretty bad, as all of us Rupertites know, having an intensive care unit close by is just such a relief for all of us to, you know, be able to access that care quicker. And the last thing I'm going to say is the hospital increasing from 3 to 4 ORs. Again, I think that just illustrates the importance of maintaining our OR services here, and you can see clearly that is all of our intent.
I was just going to add to that, for people who aren't aware, Prince Rupert Regional Hospital has 3 ORs. One that was is brand new. And we have been operating at 1 OR during the worst of the pandemic, but recently we went up to 2 ORs. And then as we can staff them, we will increase to 3 ORs running all the time. So our surgical capacity is not going to be very much different than Mills. So thanks. Chira, did you want to go back
Sure.
now to the previous
Yeah,
one, or
I'll
is
just
there more
quickly-
comments?
No, I'll just quickly touch on the patient travel piece because I know that was of interest to council, and then turn it back to you. And I think we've all been talking here, and I know this is of concern to folks. And I think with this network of services model, like I say, our overall goal here for folks living in different communities across the Northwest is to try and have as much services provided in the Northwest and in people's communities. That being said, we know there is travel that's going to be needed. The organization, really the centerpiece for this, for how the organization tries to support this, is through the NH Connections bus program. No other health authority has a program similar to this level of degree. It's not the perfect answer, but it's one of the most important ways that the organization continues to try and support patients and families. I think we've got 5 full-size coaches, 6 mini coaches running different routes across the north every week. I think there's 4 departures right now from Prince Rupert. We're continuing to make it as accessible as we can. We focus a lot on wanting to support people who have healthcare appointments, but recently, we have shifted so that if you're over 60, you can just ride. Increasing the eligibility for support people, family members, joining people. Of course, and then anyone of any age who has accessibility challenges or needs accessible transportation can also ride at any time as well. The Northern's Connection bus does also go to points outside of Northern Health to support repatriation as well, to give an access point and a way for people to come home. We are very aware of the challenges that COVID is creating, and we're going to have to do some further problem solving on that because travel's become more difficult during this time of COVID, and it's difficult for people who are either unvaccinated or with an active COVID infection. So that's adding complexity, and there's not easy answers, but we'll continue to work with the province and others to work through those challenges here that we're going to be facing more and more here over the coming months. But that's kind of one of the major ways that we support patient travel. And we're open to an ongoing evolution there and trying to make adjustments where we can. And that's where I think it's quite exciting to have something like the committee that Julia's thinking would be a good idea for the community, which us as a leadership group are all very supportive of, because I think it creates that ongoing dialogue and enables us to have clear voice from the community as we're thinking about how to evolve those kind of programs or grow them or support it the best way we can around things like patient travel. So thanks, Julia, back to you.
Thanks, Chiro. That's a perfect segue into my next slide. So I appreciate the setup there. So one thing, so as the new HSA and as someone who's relatively new to the community, I was kind of missing some institutional memory around how can we engage with our community in a meaningful way. And I've had kind of several pockets of conversations over my time so far as HSA into what this might look like. And what I was able to find as the most sustainable model that's been demonstrated to work in Prince Rupert is something which some of you actually might have participated in already, is the Health Communities Integration Committee, or the HCIC. So the history that I'm learning is that this was a co-chaired committee by local government and the health authority, and it was was in place for 7 years between 2011 to 2018. And as you can see on the slide, the aim of this committee is to get to a local forum that provides advice and assistance in addressing health improvements using a community-based approach, which is exactly the approach I'd like to use to address things like patient travel and have a better and open ongoing dialogue. What we with people in our community. I'd like to provide a forum that isn't just Facebook as a way for the community to work with different partners and the health authority to understand what their experience is, what their ideas are, what their challenges are. And so this was something that I think would be really worth revitalizing as a way to build connections and partnerships moving forward. This committee had sustainable funding from the health authority and actually still carries a balance in their accounts locally. So, and some of the things it did just before it ended, kind of just at the pre-pandemic, it worked with at-risk youth programs, seniors wellness programs, workshops and planning sessions, and did a lot of work with the Prince Rupert Youth Center. So I think there's, especially post-pandemic, we've seen a shift and a real clarity around some of the gaps in services and some of the ways that we need to support our community better. And I think bringing that to this community would be a really strong way that we can work together to support the people in where we live. So this community, like I said, is interdisciplinary, it's multi-sectorial, it is a community-based approach. So even though it's co-chaired by local government and Northern Health, I want it to really be, the voice of our community rather than sort of me updating or driving the agenda. There's many different types of partners. So, in the past, we've seen, in addition to our local government and our health authority partners, we've seen Transition House, Friendship House, our Shimshan Health Directors, RCMP, Hospice Society, Senior Center. Those are the types of groups that can come and sit at this table. And I think it would be a great forum where we can have feedback with the community, but also come up with some problem solving and be able to take the regional programs and decisions that Chiro and Yako are putting in place and create some really positive localized contextualization to those choices that will fit for Prince Rupert. Because as we know, across the north, we have such a uniqueness in each of our communities that while we're trying to create a network of services, we need to be able to tailor. And that's the part that I like to do, is kind of translate what Yako and Chiro are working on and then work with our community to tailor that to what works really well for people in Prince Rupert and the District of Port Edward. So in terms of next steps, I think what I would like to do is I'd really like to see what Council's opinion is on revitalization of our HCIC committee and work towards finding sustainable funding mechanisms. And as Chiro mentioned, using this committee as a way to work on patient transportation and scheduling for out-of-town services. And if we are seeing this more sustained network of services within the Northwest specifically, is there a way that we can make that patient transport focus on the Northwest, knowing that hopefully in the future, the things that we've talked about today are reducing the number of patients who have to leave the Northwest and head to Prince George or potentially out of health authority. And then I think there is some important work that continues to be done. And I know Yako is quite involved in this. But as our population grows and we are reviewing our service delivery and the volumes of our services, then we're always being mindful about what services might be able to be brought in community, what services need to be expanded. And I know Guillaume and Chiro are also kind of always having a lens to where the pressure points are and how we need to address our resources in order to accommodate those pressure points and to grow with our population. So that's something that I think we'll continually do and look at our data as we do now always. So I think there's some really exciting places that we're going to go. I really want to thank Yako and Medical Affairs for their dedication to the recruitment, and for Guillaume for making sure that the pressure is always on physician recruitment locally. I have been, I know you guys don't see at council here, you don't kind of see the bigger Northwest picture all the time, but I have been really grateful. Prince Rupert specifically has been very successful in a really difficult time of recruitment. And I think our population will really benefit from that. I will leave it up to my co-presenters to see if they have any last words for you before we close our presentation tonight.
Yeah, if I may, Julia, no, thank you very much. And just so people understand the vision that Chiro and I have, Terrace is currently just before events unfolded recently. We recognize that internal medicine is not reaching the benchmarks in Terrace, and our wait times are getting longer and longer, and the patient is not served, and we have to recruit. But after reviewing the data, the communities, the need in Rupert, we decided not to recruit until Rupert is fully recruited. It was the deliberate decision, and I had to defend it locally, and it's sometimes hard in your own community, but that's our vision, is we recruit where we think the bigger, Julia said, the pressure point is. It's very important to Chiro and I to stabilize Rupert. We saw a golden opportunity for internal medicine specifically to anchor, because it's supportive of all services. It will propel surgical services as well forward and strengthen that too. And it's very important to have that in Rupert. So just to understand that there's not any community-centric view anywhere. We look across the region and we try to be absolutely strategic in having an evenly weighted strategic approach to physician recruitment and services.
Thanks, Jaco. Chiro or Guillaume, do you guys have any closing comments?
You can go ahead, Guillaume.
Well, I don't really have that much to add. I think there has been a lot of work being done behind the scenes, and we're still working on further recruitment. And since Rupert is a priority for all of us, and I'm signed up to talk to some family medicine new grads coming up in December. We're presenting Prince Rupert. We're talking to them. We're selling the place as a great place to raise families, and because it is. It's not a word of lie. It's very easy to tell people these things when it's really truthful and heartfelt. So I love Prince Rupert. I love being here, and I'll keep batting for this team. I'll definitely do that. The other thing is I'm very grateful for the support we've received from Jaco, Chiro, and from Northern Health to recruit these specialists. I think the quality of care that we're going to provide going forward is going to be amazing, and I'm very excited. And I can tell you all that our whole physician group's very excited with these new recruits, and I really see good things happening. I think once we get these additional services on the ground, we're going to do some amazing things locally. So very excited, actually.
Thanks, Guillaume.
Yeah, I think I'll just end with some thanks, and I think just some praise for Julia and Guillaume. This is there's a lot of discussion and rhetoric in the public sphere around how hard it is, and right now with the pandemic, and to see how successes that can still be had in such a tumultuous time, and to see two leaders who are raising their young families, and just to be able to see the hours of commitment, sometimes stretching way beyond anything that would be reasonable. The time they put in to support the community, to support people that are very sick and in their times of need, and support the clinical teams. They're really, you just can't, there's no adjectives to really describe it. So I think a huge debt of gratitude for what you two do, and the support you provide to the community. So I just think a forum like this is an opportunity to really just publicly put that out there and acknowledge that. And Jaco and I thank you. And hopefully this presentation answers many of the questions that Council had. Thanks.
Thanks, Chiro. And thanks to my team for their support and time with this presentation. Mayor Brain, I can turn it back over to you and to Council. Thank you very much for the opportunity.
Great. Thank you for the presentation. Very thorough. on those unreasonable timelines. It's now 8 o'clock, and I'm sure you guys all want to get home to your families as well. But I think council might have a couple more questions here, if that's okay with you guys, to keep you on the line just a little bit longer. Personally, I think that's a great idea about the committee, revitalizing that committee. I got the perfect co-chair for you as well, so we can definitely chat more about that. And if you guys can bring forward some terms to us, this community needs a way to get surveyed, to be able to have people have input. That probably seems like a good mechanism for that. So that's something definitely I think we would support. But I'm going to hand it over to council. I think they might have a couple follow-up questions, and then we'll let you guys get on with your evening tonight. So do you want to start with Ms. Councilor Adie and then Barry, or Mr. Cunningham?
There we go. Thank you. I'd like to thank you specifically for the presentation and for the articulate way in which you covered a lot of the questions that we had provided for you. I think it paints a portrait of a much more nuanced work in progress than perhaps the public discussion credits it with.
Did you guys hear that?
We just
Yeah.
heard you say, did you hear that? So sorry.
Okay, yeah, we lost you for a second there. Go ahead, Nick. Start again. Sorry, I had a feeling that happened.
I was on a roll too. I'll make that a little shorter than it was. I thanked you for the coverage of the questions that we had provided for you. You did so in a way that I think helps us understand that the situation is more nuanced and evolving than perhaps it's perceptible to the general public, and I think that's really important. I'm also very appreciative of the degree to which you are adopting a model that addresses local needs on site in the local communities. I want to extend the thanks, just while we have the opportunity, to all of the people who work with you in various capacities, especially in light of the last couple of years. It really must have been tremendously difficult. And so that leads me to my question, which perhaps has emerged since we first started talking about bringing you here. And that is the kind of, in the COVID pandemic, the public discussion is often around, vaccinations and hospitalizations and the mechanics of actually dealing with the illness. And the elephant in the room, I think, is the impact it's had on people of all ages in terms of their mental health. And I appreciate the fact that the Mills Memorial Hospital is looking at expanding significantly its way of dealing with significant inpatient mental health. But I do think that there is a range of mental health needs that lies in between inpatient services and those who don't need mental health help at all. And I'm wondering whether there has been any discussion, or and it may be a provincial question rather than just Northern Health, at addressing the impacts of the pandemic on the mental health situation for people of all ages, whether that's kids who have experienced isolation, perhaps senior citizens in the same circumstance, other people dealing with stresses in the workplace, and I suppose including people working in the healthcare sector itself. Do you see, as you plan the model moving forward, do you see a way of prioritizing the impact of the COVID pandemic on people's mental health?
Yes, I'll just jump in and start here. So it is a provincial discussion. I think recovery is something we often don't spend the same time and attention to that we do as in terms of responding to the crisis. And I think, this going through this pandemic is something that is new for all of us. It's something that has not happened significantly in anyone's that's, actively working here lifetimes to this degree. And to have a protracted crisis like this, I think, there's so many unintended consequences, which you described, many that are front and center. So, I think the short answer is there's a lot of work to do there. And I think what you're describing is it's going to be really important work. I don't think we have all the answers right now. I know if we think about, what we're thinking about for our teams in the Northwest, clinical teams, we've done some things, but they're very small and it's only just a beginning. And there's going to be a lot more work to do as people go, that supports are going to need to be in place to recover. And as British Columbians, as a society, there's going to be a lot of work ahead. And like you said, probably more where we're going to need to add intensity for specific groups in our society that might have, where the impacts may have been more significant. So I think that's this is a whole other presentation in of itself, but it's a really important issue and there's a lot of awareness of it. And I think more to come and we're not talking months, like there's years of different things that are going to have to happen. And this is all, of course, happening in the midst of an opioid crisis where we have seen significant, and again, this could be a presentation in its own right, in terms of investments, both in Prince Rupert, but in the Northwest and across the North and the province around trying to increase supports for people that are addicted to opioids and the consequences that we're seeing from that. So very significant issue. I'll leave it to others if they want to add, but there's a lot in there that, like I said, would take some significant time to go through even more.
Go ahead, Glenn.
Yeah, just a couple things. So from a physician perspective, I think our physician community is closer than we ever were. There's nothing like a real crisis to drive us together. And I think there's been lots of debriefing and talking with each other and also with our nursing staff. So I think we're a pretty tight-knit group at the moment. And, we've been through essentially what in our world is a war. There's lots of resources being made available to us through Doctors of BC, through the College of Physicians and Surgeons, and through Northern Health as well. And there's then from a general population perspective, there are a few resources that I don't know that all patients are necessarily aware of, but counseling resources and things like Bounce Back BC program, which is a very, very good program. And I've been referring lots of my patients there. They've been having really good experiences, and so excited that that's very available and accessible in these times as well. But still recognizing that the work for us locally to support mental health in our region continues on a daily basis. Myself and Julia have multiple discussions about mental health all the time.
Yeah, and I can speak from just an organizational perspective internally, at least. One of the things that the Northwest and actually Prince Rupert, my West cluster, was the very first ones to roll out in the North, was we adopted the Red Cross psychological health and safety training. So there's two components that we rolled out for our staff under this. And so we funded this training for them and their time. And the two components that they were able to engage in was taking care of self and taking care of others. And now that training has actually, we were like the pilot site. And then that training has now been rolled out and offered to all employees within Northern Health. So we did that quite early on. As I said at the beginning of this presentation, health and safety, specifically psychological health and safety, has been a real focus of mine since coming on board as the HSA. And so we started with the Red Cross program. We've held several like critical incident stress debriefings with our teams in order to support them. And I'm also engaged with organizational development on this new initiative that they have, which is called the Path to Psychological Recovery for Healthcare Workers. So actually, it's timely you asked your question. I had a meeting about exactly this topic today with them. So we will be rolling out a Joy at Work initiative here internally to make sure that we're giving our employees time and space to process what brings them joy and what's getting in the way and how we can address that. So I think the broader community response to mental health that you identified is significant, and as Chiro said, would take quite a whole nother hour to present to you. But I think from multiple different perspectives, it's front and foremost on all of our minds. Thanks for the question.
Yeah, I also like to thank you. That's an excellent question. And Jerome referenced the war. I mean, there's a lot of this is very analogous to a war because of the unpredictability of our day-to-day events, the unintended consequences of the events in our facilities, and the collateral damage that's occurring unintentionally. And like in a war, once the shots die down, we're going to have wounded people everywhere. Where we are now is really in the midst of it, and we're just fighting to survive. And we do triage and we do first aid for our people, and that means our patients, our co-workers, our staff. But we have to get beyond the first aid phase after this, and that's going to be the more comprehensive interventions. And I don't know what that's going to look like. But I tell you, there's people with almost PTSD coming out of this. And so, to Chiro's point, this is going to last for a long time. And I just want to build a little bit on what Chiro said at the end of the previous conversation, is when he talked about Julia's and Joan's leadership in Rupert. It's much easier to lead when things are going well and the challenges are not there. But when you hit this level of intensity in healthcare facilities, that's when true leaders emerge. And Rupert has been recognized as a bastion of defense in the COVID war. When this last wave hit, they did it with very little resources, with no internal medicine ICU on site to speak of, and did it uncomplainingly. They dealt with it. And so we're very proud of, Chiro and I are very proud of you and what you did. And we acknowledge that. And I think the town council should be very proud of who they have as leaders in your community as well.
Thank you, Jaco.
Thank you. Councillor Cunningham.
Okay, a couple of statements. First, I'd like to recognize all the health workers in Northern Health. It's one of the largest and most diversified hospital regions in BC, and it's very challenging for not only the staff but the administration to look after what's been going on. And I think we should all recognize the frontline workers for what they've been through and still going through. Secondly, I'd like to praise both first Julie for her open improvement in communications with the city over a period of time. It's fallen apart a bit because of COVID and everything going on. And also I'd like to thank Ciro for being available when I have questions to bother him with. But and with that said, there's a definition of two things that came up in that presentation. It says orthopedic services will change but remain close to home. What's your definition of close to home? Being from Rupert, close to home is Rupert.
Yeah, you can go ahead, Jaco, if you want to start.
Yeah, I can start. Close to home, as we referenced, is in Rupert. What we foresee is an orthopedic service that's diversified, meets a broader range of needs for the whole population, is accessible, has shortest timelines, and for that you need capacity. You need a group of orthopedic specialists that work together to create that capacity in different sites with different capabilities. And so close to home might be in Rupert at your doorstep, it might be in Terrace, it might be in Smithers or Kirimat, depending on where a program might settle. or where the capacity is. And a lot of it will be based on patient preference. A patient can, like I referenced before, can decide to have the surgery in Rupert or can decide to have it elsewhere. But one thing we have realized is we need to up the game. One thing we've learned through this COVID pandemic is that we cannot be at the mercy of other people's capacity and decision making. And Chiro and I firmly believe we have to become self-sufficient in the Northwest and independent when it comes to service delivery, and we're not. We're going to have to move beyond just core orthopedic services, and that is going to require a very difficult and intentional recruitment campaign to create a group of orthopedic specialists delivering a diversity of services in different communities across the Northwest.
Okay, my second thing I'd like clarified, it says all ORs and hospitals across the Northwest are going to be required to meet population demand. Well, it's recognized that Prince Rupert's going to probably be the epicenter of growth for the next 5-10 years. So when you're talking about ORs and population demand, how are you basing that on what's happening today or what's happening in the future? Because the Port of Prince Rupert's already predicted anywhere from 1,500 to 2,000 jobs. Whereas, say, if you look at LNG Canada, you're talking 300 jobs. So just with those figures alone, the demand for medical services is going to be a lot higher in Prince Rupert than anywhere else in the Northwest. And the fact that, with the services being downgraded in Haida Gwaii for chemo and other things, and it being harder and harder to recruit people, then the outlying villages and that are going to be relying more and more on Prince Rupert Regional Hospital for their services. And it's quite demanding to bring people from Haida Gwaii to Prince Rupert to begin with, but when they have to travel farther up the line for other specialized services, it gets kind of iffy whether they're even going to take the services or go for them. But I'm just curious what meet population demand actually means in that statement.
So what we do is there's a couple different processes that we do to look at this. I mean, and this will eventually happen in the not too distant future for Prince Rupert, where when we talk about at a hospital level, we go through very distinct processes, like a master planning process is what we call it. And we follow that up as we get closer to building new hospitals, where we keep refreshing and renewing this. But during those master planning exercises, we look at population estimates, projected population growth. We look at different incidences of different diseases, illnesses, procedures that are happening. Start to translate that all into OR rooms and beds, and basically go. That's sort of one of the major processes that we have, and we do that kind of master planning exercise at 4 different facilities at different interval periods of time. And I'd say Prince Rupert is going to be up for having one of those completed in. It's hard to say exactly, but I've been thinking likely in the next few years, if not sooner. And so that'll be one major point where we're able to look at that and see what the future holds. We can also do, if we're seeing surges or these things significantly change ahead of those kind of hospital large master planning exercises, we can always do more discrete specific pieces of analysis, and then we can make major capital kind of decisions if we want to do a major renovation of some kind or a change in a facility, so that we can match capacity to a new demand that's emerging. So that's sort of the 2 major streams in which we end up making adjustments to infrastructure to match new and emerging demands and population growth.
Yeah, I can just talk from a medical affairs perspective, So as you could probably understand from our presentation, through our discussions and understanding on many levels with people like Jerome and Julia, but also others, as well as some of our newly appointed leaders in surgical services, and utilizing Northern Health analysis, we are increasingly metric driven and numbers driven. So it's actually a very good question, and I'm glad you're mentioning the population growth and the numbers. So here in Northern Health, in the Northwest, we have 86,000 people that we are serving. Some of them are very remote areas, like in Stikeen, that have to travel very far. Some major population centers that have to travel far. And so in that context, it's a really complex, shifting environment. But as you can tell, we definitely are very much aware of some of the pressures on the Western Seaboard. And hence the anchoring of this service with, you currently have more surgeons you've ever had in your history. And that's not just for the current state, that's looking at the future. And when Jerome talked about ENT, urology, plastics, you have increasing range of services you've never had before. That's just growing. And as the operating room capacity normalizes, Julia has referenced that at the moment they're running 1, and then 2, and then 3. You'll have a tremendous access if all these positions are fully recruited, or when they're fully recruited, a tremendous access that you will definitely be palpable. So to your question, yes, we are very well aware of that development. We're currently not just investing in one region, in one area of the region. We're looking at all the busy corridors and try to anticipate where the pressures and the numbers are going to come from, and recruit accordingly and plan accordingly. And that's what we've presented to you tonight.
Barry, one way that I can see what Chiro and Jaco just said very tangibly is in the main floor redesign. So in that process, what we did is we looked at our historical data of how many people come to our ER, when do they come, and how acute are they? So how sick are they? There's a rating scale of 1 to 5 on how sick they are. So we have all that historical data, and then we have population incidence and prevalence of these types of things. So you can take the larger community-based incidence prevalence data, you can take our historical data, and then you can do projections. So you can say if you grow by 5,000, you're going to see, this many more patients with X diagnosis, or you're going to see this many more patients of this Y diagnosis. And then that is what we use to inform our service delivery. So we're using that model, that data-driven, evidence-based model right now in our main floor redesign. And then, as Chiro mentioned, in the master build plans, you do that, but on a much, much bigger, not just a single department level.
Well, using that model, Julia, I'd be a little concerned because I don't know exactly what the ratio is for general doctors, JPs in Terrace versus Rupert population base-wise, but I think Terrace has more GPs than Rupert does, so we have a lot of people in Prince Rupert that don't have a doctor. So they go to the ER sometimes for minor ailments that aren't as serious as if you had availability of a doctor and you could go see him. So, I don't know how you capture that type of statistic, but that would be something that would concern me. And my other concern is that, 10 years down the road, oops, we made a mistake, and all the services are in one hospital right now, so it's even when we do build another hospital in Prince Rupert, which is going to be 10, 15 years down the road, maybe Chiro can answer that question better than anyone else, but I'm pretty sure Smithers is going to get the next hospital, and then from what I understand, we're third in line, which will be quite a ways down the road. But that said, I'm just concerned that I don't want to see down the road, oops, well, we've got the services here now, so we'll just keep them here anyway. And, I'm kind of territorial that way. You guys know that. I'd rather see stuff in Rupert, but, at the same time, it's reality's there. But I don't want that reality for Rupert to miss the boat 10 years from now But that said, we'll leave that for now. But two questions for Julia for our hospital that have come up. One is the COPD clinic for Nelson Kinney. Where are we with that?
Okay, one quick point, and then I'll answer that question, Barry. So just to let you know, it's actually quite easy, and we pull the statistics on who is attached to a family physician and who isn't. And we actually have a very, very low percentage of our population who's unattached. So just to reassure you that we are looking at that data. And then in terms of our COPD clinic, actually, I think Chiro has the best update on that one.
Before we go there, if I might chip in, just on GPs and Terrace, because you referenced Terrace, so I have to respond to that. Terrace has a significant primary care provider shortage at the moment, and we have literally thousands of people unattached right now. Our manpower plan calls for 26 FTE, that is full-time equivalent positions. We currently have 19 physicians, but that only translates into about 16 FTE. We've got, I think, conservatively between 4,500 and 6,000 patients in this 31,000 immediate surrounding area that don't have family doctors. We cannot staff our emergency room rota. We had great difficulty getting a COVID group going, and it's compounded by the lack of internal medicine capacity as well as pediatric capacity. So Terrace is not in a good shape when it comes to primary care right now. In that context, though, Jerome knows that we do not give preferential treatment to one community, and we have been very successful in actually recruiting more physicians to Rupert lately and when we go through blitzes, than to Terrace, or equally so. I just want to reassure you. I know you're a big advocate for your community, and that should be that way. There should be people like that advocate. But the perception is not accurate. Terrace is going through a very difficult time right now.
The other thing. Pardon me.
I was just going to say on the Nelson Kinney COPD clinic. At this, the organization is very supportive of doing that naming in his honor. It would be a very good thing, and I think a great honor. So those approvals are all underway and in process, and I think I think I'll leave it at that. We've just got some final work to do, in particular in terms of working with the family, I think, on that. And so I think that's just going to be a matter of course, where we get that named in his honor, and rightly so. And then I just say, your worry, Barry, about things being somewhere else or not going somewhere else. I think I'm just going to go back to the key message. I'd say that, what we're hoping, one of the things to take away from today's presentation is that that's the exact opposite of what we're doing, where we have services across the Northwest, in communities across the Northwest. There are services in Prince Rupert. There's not an intention. The constellation of those services do have to evolve. They do have to change. And that's a process that happens over time. But the end, the fact is it's all about, for us, continuing to create that capability and possibility, and to actually have those services and a variety of services happening in each community. So I just don't. I guess I appreciate where you're coming from in terms of wanting to make sure that services are maintained in there, and I think we're just trying to show that is what's happening. That's the case. And so I don't quite see I know we see it maybe a bit differently there, but that's kind of the best I can describe in terms of trying to alleviate the concern of the worry.
Can I just say one thing about family physician recruitment? So just so you're aware, it's a huge priority for me, and myself and actually Dr. Kloppers have spent countless hours on working on family physician recruitment specifically. And it's really hard to recruit at the moment. It's not that easy. And I would happily advertise 10 positions, but no one applies to a city that has 10 vacancies because the physicians look at that and go, oh no, that boat's sinking. I don't want to go there. So we're advertising modest amounts. As we fill them, we keep the positions open as active positions to recruit into. So we're happy to take, any, well-qualified, well-trained physician to join our team. And we welcome you. If you know of anyone who has interest to come here, please approach me or Dr. Kloppers, and we'd be happy to further those conversations. Primary care is the backbone of healthcare, and there's definitely a focus for us to continue to recruit to those positions. So, hopefully that helps.
No, the presentation tonight, I think, has alleviated a lot of problems, questions that we've been receiving from the public and that. And, there's some misconceptions about Northern Health and what's going on and things like this, and the fear of when you turn left coming over the overpass in Terrace and seeing that big hole there. My God, how big's this hospital going to be and what are we going to lose? And I think you've answered a lot of questions that a lot of people have asked us individually as councillors and the mayor, and that I'm just looking 10, 15 years down the road. That's all. I won't be here probably, but Lee'll have to suffer. Anyway, thank you very much for everything tonight. I really appreciate it.
We'll go to Councillor Niche, then Councillor Morrow.
Thank you for your presentation. The one question I have is with the recent from the government, mandating the vaccine for healthcare workers. I'm just wanting to know what the impact is specifically for Rupert, or the projected impact and the loss of how many healthcare workers in Prince Rupert, not just in the whole Northern Health.
So I can maybe just tell you that we've lost no physicians as a result of that mandate.
That's correct.
And I'd say we've lost. There's probably a handful of other providers that would be impacted. I want to be careful because the numbers are getting small enough that I just want to not breach any confidentiality. But I don't know if there'd be anything further you'd want to say, Julia, without risking any confidentiality around that.
Yeah, I think I get this question as well, because we've seen the headlines of thousands of nurses and that kind of thing being out of work due to the PHO. And what I say is actually my West cluster is very minimally impacted by the PHO order. My biggest concern for losing staff is burnout and fatigue. It's not the PHO order. I would say under a dozen.
Thank you.
Councillor Moore, then Councillor Randhawa.
Thanks everyone very much for your time and for your presentation and answering all these questions. I have two questions, one related to the recommendation on the committee and then another going back to kind of the decision-making process. On the Healthy Communities Integration Committee, I think that multi-sectoral approach is a really effective way to bring together a variety of stakeholders. I'm just wondering, in its previous iteration, were there any provincial ministries that were a party to that committee? And if so, which ministries? And if not, is it appropriate to try to involve them?
That's a really good question. So I know MCFD was part of the previous committee, and sometimes the MLA would come and engage. But I think that's a really good point. We can explore that and look at how we want to change that in the future.
Okay, that's great. As long as we're open to that, I think that's going to be our most effective path forward, is to bring a variety of service providers together. So I agree with the mayor that I do at first glance really like that approach. And going back to what you guys have been talking about in terms of your master planning decision-making processes, trying to gauge, as need increases, monitoring thresholds and things like that. I'm wondering, the response was that maybe Prince Rupert's next master plan is looking like it's in the next few years. I'm wondering how can we best help you guys, or who do we need to advocate to advance that timeline? Because one thing I think we haven't really hit on explicitly is the level of industrial growth, port-related growth, and expansion that Prince Rupert's set to see over the next decade, if we're waiting a few more years for another master plan to be complete for Prince Rupert specifically, I'm concerned that the population growth that's going to take place in that time is going to put us a little bit behind the 8 ball. So how can we best support you guys, or who can we advocate to try to advance that timeline?
Well, I think there can always be, there is ongoing dialogue through the Northwest Hospital Regional District with Northern Health on master planning. And then I know through the UBCM, there's also an ongoing way for dialogue with Northern Health on, I would say, matters like this. I don't necessarily think there's so much advocacy required here. I think we're quite wanting to do this. It's just that this is probably an exercise that also, if maybe we hadn't been in a pandemic, would be closer to what it is right now, and is one of those things where it's a capacity situation. As Barry described, we recently did a master planning process at Bulkley Valley District Hospital, and yeah, I think it's something we'd want to look to do for Prince Rupert Regional Hospital in the near future. So I'd say there are some avenues to engage with Northern Health that already are in place, and so the dialogue could continue there. And but I think it's not like there's much advocacy needed here. It's just working through the ability here, and especially as we're continuing to focus, having to focus a lot on our pandemic response.
Okay, it's getting late, so we'll do one last question from Councillor Ranhawa, then I think we should wrap up.
Thank you for your presentation. Very informative. Many of our residents are watching from home, and our Northern Health leaders are here. So wondering if you have any update on COVID and any advice for our community. Thank you.
In terms of a COVID update, or the advice would be definitely to although you've done tremendous, incredible work as a community, and you have very good vaccination rates, but I think the biggest advice to give is if there is anyone that isn't vaccinated, then we would strongly encourage that to engage with their family physician if they have questions. Or some of the myriad of resources that are out there provincially and on the Northern Health website to answer questions that folks have. We're recently now embarking on a booster program. So there's, would strongly encourage folks that do have the vulnerability. They would have received we describe clinically extremely vulnerable, but those who have other chronic conditions, illnesses, things that could compromise their immune system, they would already be received invites to be encouraged to book. We've got older members of our community, our elders, those over 70 as well. We're going to be invites will be more and more coming out to those groups, also encouraging them to come to book to get vaccinated. Booster campaigns will be occurring in Indigenous First Nations communities across the North as well, very near future. And healthcare workers who had a very short interval between dose 1 and dose 2 also be a prioritized group here. And teams worked hard also to get boosters for those in long-term care and assisted living. So get vaccinated, get your booster if you're eligible would be the number one piece of advice. We are still very much in the midst of a fourth wave. If we look at it from a northern perspective, I think I continue to be hopeful and optimistic that we see the benefits in communities like Prince Rupert and in out west here from the immunization, but there are still clusters that we're seeing across the north. There's transmission still occurring across the north. And it is stretching even the transmission we're seeing among those that are primarily unvaccinated is stretching us to the max. It's leading to ongoing hospital admissions. The Delta variant is more serious than the original variant, and so even though we've got a lot of people vaccinated, the transmission that's occurring among the unvaccinated is making them very sick and leading them to need hospital care, and it's stretching clinical teams immensely, and so that's kind of we're hopeful that we are kind of at a plateau, I guess, if describe it that way, in the fourth wave. So hopefully with the leadership and the public health measures in place that we're getting from Dr. Bonnie Henry and our Chief Medical Health Officer, Dr. John Kim, and our Medical Health Officer team, along with the ongoing vaccination efforts, we're hopeful that we'll be on a slowly improving trend here out of this fourth wave. And hopefully, if the vaccination rates are high enough and all going well, then hopefully this can be a final wave for us, is I think what we all hope. But we're not out of it yet.
So maybe I can just, as a physician in the community, also say I'm very grateful to everyone who did choose to roll up their sleeves and take the vaccine. I recognize that for some people it's very difficult to make that decision, but I can assure you from my firsthand experience caring for patients over the last 18 months with COVID, that the vaccine, honestly, in my best medical opinion, is safe and clearly effective. So I would encourage you, if you're having concerns, please have that conversation with your physician, with your care provider. There's nothing in it for us but your best interest. So if Churro wasn't clear enough, get vaccinated.
And I will, just to update the council with some positive statistics, just to let you know, we are, as a community, over 90% coverage for our first dose and over 85% coverage for our second dose. However, that still leaves over 1,000 people that need to be vaccinated. So there is still a good chunk of the population that we need to access. So, you know, if you've been vaccinated, maybe try to talk to someone or bring a friend to get your flu vaccine and your COVID vaccine at the same time. In our public health teams, we're still offering drop-ins for dose 1 and dose 2, booked appointments for boosters, and COVID swabbing is ongoing. The most important thing you can do to receive your booster is ensure you're registered in IMSS-BC, because that's where the notification will come from. We will not be doing a large community mass clinic like we did for dose 1 and dose 2. So what it will be is IMSS-BC will be notifying everybody in a rollout to make sure we don't overwhelm our services, to let them know about the booster. There isn't the urgency to the booster campaign as there was so dose 1 and dose 2. So we are securing additional space in the Ocean Mall, where it will be kind of immunization headquarters until the spring.
Thank you very much. That I think cleared up a lot of information that I know our residents have been asking. Normally we don't let presentations go this long, but we do know that this is a topic of interest for the community. So I think it was important to flesh out all the details. The presentation clearly shows how much work is being put into the Prince Rupert Hospital. I've personally been involved with the recruitment and retention. I've been toured with many doctors, with Dr. Kloppers. We tour them around town in a vehicle, and we take them for lunch, and we all work together to try to recruit. So that's definitely been part of that. I see it on the ground. I think it was important for the narrative around Northern Health and Prince Rupert in particular to start to shift, because we have regular conversation, Julia and Churro, but the community, I would say, needs an update, or like a software update in terms of how it perceives what's happening at our hospital, because I think we're still kind of thinking this is 2010 in some ways, when really there's been a lot of progress made, and clearly a lot more that needs to be done. So I think this committee would be one of the things, if this committee does get rolling again, is we should start surveying the community and really making sure people are getting their voices heard in what they believe the problems are, and so that there is a clear place for people to express those concerns. Because the fact that people have to come to city council to advocate for healthcare issues is, I think, a problem. That's not our job. We're here to run the community in another way. But we are advocates for the community, and if that's where they feel they can trust that information, then this is why this has been organized here today, for you guys to come forward. So I think a place where we jointly work together, making sure people's voices are heard, making sure we're addressing those concerns and keeping a pace, like has been mentioned, the population growth in particular, we know could go up to almost 20,000 people here by the end of this decade, given the current projections of the current growth and current job growth. We're looking at having to build like 2,000 plus housing units. I'm pleased to hear that you guys actually invested in the housing units. That was one of our suggestions through the Redesign Rupert process, Julia, as you remember. So I'm really happy to hear that will help with that temporary bringing the recruits to Prince Rupert, getting them situated, and then letting them have the chance to find a place here. That's going to be, I think, really helpful for healthcare workers in particular. So good job on that. So let's continue the work at the committee, and then we can work with our corporate administrator to get maybe the terms up and running again, and we'll get moving forward. So we'll let you guys have your evening back. Thank you so much for your time, and we really appreciate all the hard work you guys have been doing for the community. Thank you.
Thank you very much. Have a good evening.
Bye.
Okay. What time is it? It is 8:45. Item 5A, DVP for 2113 for 1002 First Avenue West. Is there any other further comments about this? Nope. So the recommendation that council approve development variance permit application DVP 2113. Moved by Councillor Skelton Morford, seconded by Councillor Cunningham. Any discussion? Okay, all those in favor? Anybody opposed? Motion's carried. Okay, next we have a report from our Chief Financial Officer regarding the 2022 Community Enhancement Grants. Oh, sorry.
Thank you. Every year, Council opens up the opportunity for a community enhancement grant for the upcoming budget year. Given the continued COVID-19 pandemic and its impact on events, this year's recommendation from staff takes into account the need for continued flexibility, specifically with respect to cash awards. Additionally, the city's operating fund budget, which funds the community enhancement grants, is anticipated to face challenges in 2022. For this reason, staff are recommending to have no increase in the overall total amount of grants funded when compared to 2021. The total recommendation is $1.363 million. Specific recommendations have been made and are attached to the report to Council as an aid. The recommendation provides for grants to all recurring grant applicants, to new applicants, provides funding to those through agreement as well as that requested by the library. Council is asked to either accept staff's recommendation or direct staff as to which applicants will receive a community enhancement grant and the value of each grant awarded.
Any comments from council? So if somebody wanted to move the recommendation that council awards the community enhancement grants that's presented by staff, then moved by Councillor Cunningham, second by Councillor Niche. Discussion. Councillor Adie. Nope.
You'll get the hang of it. I just want to thank staff, as always, for the work that goes into putting this package together. I'm happy to support their recommendations.
Discussion. Okay, all those in favor? Anybody opposed? Motion's carried. Thanks for all your work on that, Ms. Baumann. Next, we have a report from the corporate administrator regarding the Prince Rupert Golf Club letter of support. Any comments? Nope. So the recommendation that council provide a letter of support to the Prince Rupert Golf Club as requested. Moved by Councillor Cunningham, second by Councillor Niche. Any discussion? Okay, all those in favor? Any opposed? Motion's carried. Next up, we have a report from iPlan I guess it's not iPlan anymore, is it? Report regarding the ZBLA 2101 City of Prince Rupert zoning bylaw number 3462/2021, amendment bylaw number 3478/2021. Any comments?
This was the bylaw for the public hearing, and it's council's position to determine whether or not to advance it.
Okay, so recommendation that council give third reading to the City of Prince Rupert zoning bylaw number 3462/2021, amendment bylaw number 3478/2021, and that council require the applicant to consolidate the lots prior to final reading. Moved by Councillor Cunningham, second by Councillor Niche. Discussion. Councillor Adie.
Just a question. This is the second instance in which we're being asked to consider something that's already in place. Just from my own perspective, I see some significant differences, but it did occur to me that I'm wondering why the application is to reclassify it as RM2 rather than RM1. The differences, as I understand it, have to do with the lot coverage in RM2, which is what's being applied for. You get 50%, not more than 50%, whereas RM1 would be 40%. There's a difference in density, and perhaps most significantly, a difference in the principle in the maximum building height. So in RM1, the principal building height would be 10 meters. And in RM2, which is what's being applied for here, it's 13 meters. Now, I can appreciate there's probably no current plans in terms of that building to utilize that kind of height. I'm wondering if there's an actual reason why we're looking at RM2 instead of RM1.
Through the mayor, I don't believe that the density was sufficient in RM1. I'd have to take a look at the numbers. RM2 is the zone that this fits. If height is a concern, council can add a condition to have a covenant put on the property to keep it at 10 meters in height.
Then I think given it's, I drove by today and it's a dwelling in a neighborhood of other similar dwellings. I think it would be appropriate to ask that covenant be put in place. I will make that motion, yeah.
So moved by Councillor Adie to amend the motion on the floor to include a covenant to keep the building height at 10 meters. Seconded by Councillor Cunningham. 9 meters?
That's council's discretion. 10 meters is the RM1 limit. So 9 meters or 10 meters, it may not matter that much, but it's your discretion.
Okay, we'll keep it in line with the RM1 then. Any discussion on that motion? Oh. On the covenant? Okay, all in favor of the amendment? Anyone opposed? Motion's carried. Okay. Now we have the amended motion on the floor.
My question on this rezoning is, well, there's two parts of it. One, we're looking at something that's in existence again, but do they have enough parking?
Through the mayor, 4 stalls is what's required, and I believe that 4 stalls are provided on the site.
Because I've driven by there at night, as late as 10 o'clock at night, and there's 6 or 7 cars parked in front of there or on the road as well. And I've been told so that there's more than 4 units in that building right now. So I'd like that looked into also. And also I notice there's a lot of construction going on in that building, and I don't see any building permit on display. So again, I don't know if we've got another problem with construction going on and,
before this is passed or not, but it's something else I'd like to check into.
Mr. Mayor, if council would like staff to investigate the number of units and the requirement for a building permit prior to adoption, we can certainly do that. This has to go to highways for approval first, and we also have to have the covenants prepared. So if you want a final report on compliance with parking and compliance with building permits and the number of units, we'd be happy to do that.
That sounds good. Well, we can pass 30 reading this evening, and then we'll have that information for final then.
If you want it for final, I would request that you make that as an addition to the motion.
Is council wanting that information then? Yep. So we'll pass another. You're going to make a motion to request that information as part of the final reading? Seconded by Councillor Cunningham? Okay. Any discussion on that additional information?
So just my question is like a house is already built, right? About the height. So height is already there, right? So how, if we change the height, how can that impact? We already made the motion, like the house is already built, right? So how if we say okay 9 meters or 10 meters, right? But it's already built there.
I can quickly answer that. The issue is that they may change use later on. Someone else might own the place. They might tear it down, and all of a sudden they're RM2, and they have the ability to build much larger. This is making sure that the property itself is being contained within its existing footprint. That's what we're ensuring. That's all it is. Correct? Okay, so the motion on the floor is to amend to add the items to we've requested to have investigated by final reading. Any other discussion on that amendment? Okay, all those in favor? Anybody opposed? Motion's carried. Now that has now been added to the amended motion, which is still on the floor. Is there any final discussions about the additional covenant, the additional items that we're looking for by final reading? At all? Okay. All those in favor? Anybody opposed? Motion's carried. Thank you. Okay, any questions or inquiries, members from council? Councillor Cunningham.
I'll make it real quick. First, I'd like to point out that I'd like to recognize Alison O'Toole for being named the drama teacher of the year for BC, which is quite a I think recognition for her talents and everything. And secondly, because of the change of time now and it's getting dark, I'd like to caution drivers and pedestrians because a lot of the crosswalks you can't see and there's not lines out there. But I would like to point out to drivers and pedestrians to be a little more observant this time of year because drivers and pedestrians can't see each other in this type of weather and that. Other than that, let's have a good night.
Thank you. Any other reports from council?
Yeah, I just wanted to acknowledge that it is the National Aboriginal Veterans Day as well today. So just for myself, paying a special tribute to those that served throughout various world conflicts before having kind of the rights that we all share collectively as a society today. So for those that battling kind of the traumas of residential schools, those that survived, and those that didn't make it home. So just kind of pay a tribute to those that had served. And yeah, thank you.
Thank you very much. Any other reports from council? Okay, and chain a motion to adjourn. Moved by Councillor Cunningham, second by Councillor Scott Morvan. All those in favor? Meeting's adjourned. Have a great evening.